Hello, welcome to our patient instruction guide for going home with your Privac-Tvac drain. Going home from hospital with a drain in place is common practice, allowing you to recover in the comfort of your own home. Please follow these easy steps to manage your drain at home. Firstly, I will explain how to empty the concertina when it becomes full. Step 1. Close the top clamp, and then open the bottom clamp. Step 2. Compress the concertina, using the thumb hole. The contents will empty into the drainage bag. Step 3. Once the concertina is empty, close the bottom clamp, then open the top clamp to reactivate drainage. It is important that the bottom clamp remains closed during drainage to prevent loss of suction. Now I will explain to you the process to replace the drainage bag once it becomes full. Step 1. Check that the bottom clamp is closed. Step 2. Disconnect the drainage bag from the concertina by twisting the connector, then seal the bag with the cap. Step 3. Connect the new replacement bag with the twist connector. Check that the bottom clamp is closed and the top clamp above concertina is open to recommence drainage. If you have any questions regarding your drain, please refer to the contact information provided by your breast care nurse. Thank you.